and counties to adopt regulations requiring the use of masks in public spaces. There was a number of 1, 2, 3, 4, 5 letters from physicians. And if you look at the letters from physicians, if you can look at, I'll pull Dr. Todd Yontek's. He makes 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27. I think it's about 27 references of evidence of support. And I mention that because when things are done, and I mean, 8, 9 days ago, I wouldn't have been in support of a mass executive order in Pasco County by any means. Things change, and they change quickly. When you go from 2, 3, 4, 5 cases a day to having 305 in a day, things change. We've been very, very good here in Pasco County, in my opinion, of not overreacting to things. We did not do a stay-at-home order because it wasn't justified at the time here in Pasco County. Obviously, we followed the governor's order when he did a statewide order. We've been very, very thoughtful in how we move along. And not I will say, not overreacting to the past by any means. And some of the things that happen around the state, I'll be honest, I didn't like people, they were politicizing it. We have not made this a political issue here in Pasco County whatsoever. Now we know some areas did, and I'm not naming any, but some places across the state, cities and counties, made this political issues and made them political battles. We have not done that. And I know that we've talked about this numerous times, especially on the calls that we were on previously, where most everybody on the commission was saying, hey, what a great job our health department's doing, what a great job our county administration is doing, what a great job FASA and his team is doing. And I know everybody said how much they appreciate what they're doing. And not once have we had an instance where you actually had the Department of Health, where you had FEMA, where we had multiple hospitals, where we had multiple physicians actually reach out and say, we need you to do something. We need you to do something quick. So I don't think that's overreacting when you actually have the Department of Health making a statement that something needs to happen. So I tend to listen to the advice just because of my background of healthcare professionals, scientists, whether it be physicians, epidemiologists, whatever it may be. Most of you know that I do have a background in healthcare. So, when there's a doctor's order, we always follow the order. And that's what we did. And we did it multiple times on a daily basis. We were following doctor's orders. We could not go against that order, and we had to trust that physician and the decisions that they were making. Now we have a situation where you have the whole Florida Medical Association, which is thousands and thousands of physicians that are involved that are stating something had to be done. You even had some, again, I tend to listen to, evidence-based research versus just politicians and bureaucrats. And I think that's what you should be doing. But you do have some politicians out there, people in the political world. Senator Marco Rubio said on Wednesday, everyone should be wearing a mask to prevent the transmission of coronavirus. That's states across the county report troubling surges. He went on and said a lot more. Senator Scott also that was Senator Rubio. Senator Scott's also made statements last week too about you're going to have to wear a mask. We have to wear a mask. He stated that. Even Governor DeSantis in his statement thinks that it should be done locally, but his statement, we provide education. We did an advisory at the beginning of May, and we advised that it's something that could make an impact, and he's leaving it up to local municipalities or counties. April cases 206, May cases 134, June so far 1,392. I would say we have a issue when it's being obviously spread out, the community spread now. It's a difference from what it was before. We actually have community spread in Pasco County. Nobody's denying that now. If you deny it, I guess you're not reading the numbers very closely. So I ask you to read these letters. I'm not going to read them all. Take a look at what happens, what's coming from actual physicians. and from the Department of Health and from Florida Medical Association, which is made up of physicians. That's all I have for now. Anybody else like to add more? I see Commissioner Starkey waving.
Yeah, I sent to you guys a little, well, a very in-depth study that Stanford just did. They just published it last week on mask research, and I think I will. I'm not sure if I sent it to everybody, so I'll make sure everybody gets it. But you can just Google Stanford masks, and it really goes into great discussion on these 3-ply masks and how good they actually are. Because I know some people say, well, these masks don't help. No, that's not true. And here's the scientific research to show that. So I agree with you, Commissioner Moore. I think we've been very conservative in our thoughtful process during this epidemic. We have reached a stage where we had massive spread that came very quickly. And I don't think it's any of our intention to have this emergency situation for a long time. We hope that our citizens will comply and help us bring these numbers back down to where we don't have community spread. It is not that difficult to wear the mask. It really isn't. You don't have to walk around outside with it. I heard people, I got letters saying they're going to pass out because they're walking around outside with it. No, that's not what you need to be doing. You just need to wear your mask when you're in close proximity to other people, and keep your social distancing and remember to wash your hands. I do think we should improve on our messaging as a county. I asked the administrator, because I think he does a great job, to do another some Facebook posts, Facebook Live or whatever you call those. I think we need some good PSA, 1 or 2 minute shorts to go out and explain ourselves better, why we're doing this. I think that would be, I wish we had done that before we did this order, but I think Mike did one. I actually haven't even seen that one yet, but I think we need to be spreading them more, and just being out there a little more publicly about why we're making the decisions that we are. And I think our citizens also need to know, we were in discussions about whether we should go to this order or not. And I know I gave the thumbs up. Yes, I see the numbers. We need to do something to stop the community spread before it gets much worse. Because I think if we all behave correctly, we can stop this before we get to average percentage positives, in very unhealthy numbers. We've been hovering around 2%, which is great. But if you take the last week, I think we're 13, 14%, which is not good at all. So yeah, the long-term average is low, but what we're in right now is very high. We want to get that down below 5, back down to 2, or nothing if we can. So I support what we're doing. I just didn't like the responsibility being the business owner. I thought it should be the person walking into the store, but I'll leave it there.
Thank you, Commissioner Stark. I know I have Mike Napier on the phone too, and you made a good statement. One of the things I'm scared, what really, really scares me is that we go backwards. So many small businesses were hurting, obviously when they got closed. Some of them never made it out. And I also, besides protecting the health of the community, I think we need to protect the health of our small businesses out there. And personally, if we go backwards, and they go to a phase 1 or a total shutdown again, it's going to be bad. Really, really, really bad.
We don't need that.
We don't need these small businesses having to close again. Again, bars got closed last week. There was supposed to be a brewery, brand new brewery in Pasco County that was going to open this Wednesday. Now, I think they still are to sell growlers, but guess what? They're opening, and you think they're going to be able to make rent? Come on. There's no way. And we can't have that happen again for these poor business owners. I mean, hospital admissions Friday, 11 ICU, 59 hospitals. Saturday, 12 ICU, 70 hospitals. Sunday, yesterday, 16 ICU, 80 hospitalized. Mike Napier, are you on the phone?
Yes, sir, I am.
Okay.
And if I can just provide a couple bits of information. First, I I called and spoke to the Surgeon General this morning just to get the latest before this call, and he reassured me and wanted me to reassure the board the importance of the wearing the masks, and was glad to hear that we had done that. I do want to point out that we are at 1,909 cases as of today. That means that 50% of our cases, 1,053 cases, were all in just the last week. Staggering numbers. Commissioner Starkey mentioned that we're at almost 14.5% positivity rate. We peaked at 1,674 test results coming back in, and we had 302 of those people of the 1,672 that came back positive. So we do have widespread cases out here. I would also like to mention, as the Surgeon General also mentioned, we have the 4th of July weekend coming up. And if there is some evidence that the Memorial Day holiday is where we had a lot of people gathering, and that perpetuated the cases. And if we don't put something in front of the 4th of July holiday weekend, that we could see, I could have never guessed that we would have had 1,000 in a week positive. We could see 2,000 a week if we don't do something to stop the spread. So I am in full support of what the executive order was put out, and would continue to provide information to you all to make good decisions for our community.
Thank you, Mr. Napier. Anybody have any ask
Mr. Chairman?
Mike? Is that Commissioner Mariano here?
Yes, sir.
All right, thank you, sir.
Thank you. I guess you couldn't see me, so anyway, I got a few questions as far as, or a few comments to make as far as what's real, what's not real. I think we all heard Dr. Fauci probably a month ago saying, don't wear masks, they're not good for you to wear. Now there's a change. CDC, I've got 2 doctors that responded to 2 of their patients asking about, should I wear a mask, should I not wear a mask? One of them I saw late last night that was posted, and it says, this is the doctor to his patient, follow the CDC recommendations for using a face mask. And it says, first colon point, CDC does not recommend that people who are well wear a face mask to protect themselves from respiratory illnesses, including COVID-19. Face masks should be used by people who show symptoms of COVID-19 to help prevent the spread of the disease to others. The use of face masks is also crucial for health workers. So again, it's not helping those that don't have anything. And if you don't have it, it's not doing anything. The other thing is, when I look at the MASM data, when you look at the N95 mask, it protects stuff from infiltrating that person, but with the exhale, it does nothing to protect anybody. So you may have it, you're going to exhale it out, and even if you're protecting, that's still going to go through the mask and get out in the air. The cloth masks, people say just don't protect anything. Surgical masks, those are set up for sterile environments. So when you get the amount of particles, contaminants in the outside and indoor environments where people are clogging these masks very quickly, the moisture can be trapped in there. You can trap and actually become your own worst enemy, breathing them in carbon monoxide in, but even bringing that virus back into your own system. Having said that, I thought was, I won't say perfect information, but I thought it was pretty good. The Swiss policy and research, it was a long document, had a lot of good information in it, and it talks about how the Swiss had not gone through all the same things that we had gone through, and they actually did fairly well with it. And I haven't heard anybody mention anything about the NBC News report last night that came out with like so many thousands of tests that were they came out inaccurate. I know of one person that was actually tested once positive, once negative. So what is the validity of these latest set of tests that are out there? I mean, I was watching 60 Minutes last night and talked about how maybe we allowed too many test kits to be sent out that were not approved by the FDA. And maybe these are some of the kits that they were using. And now they got to go retest all these people again to find out what the actual numbers are. So maybe part of the spike we're getting is going up. Hadn't seen anything about as far as deaths going up. And if that's been going on all this time, haven't seen any data to that. I don't think we should be making it mandatory. I think if you take a look at what we could do, make it the voluntary. I don't see how code enforcement is going to go in and enforce these things to different business owners. I don't know how we feel the authority. And frankly, I will say, I don't really like the fact that when we had the discussion, or I say my conversation with Mr. Bowser, I wasn't supportive of this, and then to see it all of a sudden get implemented, I think should have been a board decision from the get-go. I think this board operates very well with discussions, with information that gets out there, to have our administrator make this decision, which is very impactful amongst all our small businesses that are out there. That may get people just because it's going to be mandatory. You may give false protection hopes that are out there, knowing that this COVID-19 can go through these masks and not going to protect people as much as you may think. I would like you to discuss, Dan, again about how you're going to go enforce this with code. And Mr. Starkey, I share your same thing. I see code violations all over the place. If they can't handle that, I'm going to go throw this back on them. And if not, I'm going to take the sheriff's department and get them involved in it. I mean, I think we got a lot of responsible people, and I think everybody's paying attention to these numbers. I think if you give them a chance, you're going to see a lot of people wearing the mask. But to forcibly put it and then put these businesses under extra burden to do enforcement of our code, or even take our own code people off their regular duty to come back out. I mean, you're going to have them come out the next day, that night. How are you going to make this work, Mr. Bowles?
So, to commit, Mike, you're on to the
Yeah.
CDC.
Just the one thing I would say, Commissioner Mariano, I did see that doctor's orders. My guess is that was an old recommendation. That was a form letter that they were sending out. And you are correct, Dr. Fauci did indicate that several months ago, but reviewing that record, I can't tell for sure it was a current record, but it is an old recommendation. And I'd be happy to follow up with that physician on reviewing his recommendations on not wearing a mask.
If I could, then let me tell you about another doctor. I told you I had two. This is a note that I got from a person, messenger, and it said, Mr. Mariano, my young doctor told me 100% of us will have been exposed to the COVID by this December. 70% of us will be asymptomatic. About 21% will have short-term symptoms. 9% will need treatment, not necessarily hospitalization. His parting words to me were, get back to the gym and no mask. And then she makes a comment, yes, I can't follow my own doctor's advice. This is current, not old.
So, Commissioner Mariano, can I ask you, because you see the documents I gave you guys from physicians that were signed letters from the physician. What physician was that? What's that physician's name? And where's the letter?
I don't have that. I don't have that information yet. I just got it as a blank thing from a person and haven't been able to ascertain all that. The point is, there's definitely conflicting that's information out there. And for us to go make a mandatory statement, we don't know what the actual facts are. Even the CDC has changed their own position. Why would they change their position?
No, that's not true. I am looking at the CDC website right now. And the first thing it says is the CDC recommends that people wear cloth face coverings in public settings when around people outside of their household, especially when other social distancing measures are difficult to maintain. Cloth face coverings may help prevent people who have COVID-19 from spreading the virus to others. Cloth face coverings are most likely to reduce the spread of COVID-19 when they are widely used by people in public settings. And then it says children under 2 should not wear them. And then it says evidence for effectiveness of cloth face coverings. Cloth face coverings are recommended as a simple barrier to help prevent respiratory droplets from traveling into the air and onto other people. The whole front page of CDC is saying wear a cloth face mask. So I think you might have there, Jack, is something very old.
Well,
because they are recommending this is updated June 28th of 2020.
And Commissioner Starkey, I don't doubt what's on there. I was actually on the site myself, went through the whole thing. I actually asked him a question too. I haven't got the response back. I said, if I've got doctors that are saying to their patients, follow CDC guidelines by not to wear a mask if you're healthy, then why did it change? And when did it change? I haven't got a response back from that yet through their, ask questions section yet.
All kinds of.
I agree. And remember, the key word there is may. And from what I can see from the different tests that are out there, different things that are out there, and we all heard different things. I'm sure we've got lots of information from other people. But the air that can go through that, yeah, it's going to stop the saliva, the droplets, the spit that may come out with someone. But the air that goes through, if that COVID virus is going right through that mask, it's not going to protect the other people beside it. It'll
No,
help on certain things.
that's not
It
what the
may help.
scientific data says. And it says right here, this recommendation is based on what we know about the role respiratory droplets play in the spread of the virus that caused COVID-19, paired with emerging evidence from clinical and laboratory studies that shows cloth face coverings reduce the spray of droplets when worn over the nose and mouth. And one of the studies that they probably are looking at is that very, very good study that I sent you from Stanford University that actually is showing that a properly made 3-ply mask with a cotton poly exterior, a filter in the middle, and a cotton next to your mouth, you can breathe very well. You don't get trapped oxygen in there. And they're saying it's better now than a surgical mask. So I think they've come out with a lot of data on masks because of COVID-19 that will change the face of medicine. So I would be, I'm really suspect when you get something on the internet that has no backup. I mean, there's aliens landing, 9/11 didn't happen. There's lots of junk on the internet, and I think you need to be really careful.
And Commissioner Starkey, that's why I'm trying to get all the information I can from all the sources I can and getting the backup when I can as well. And again, as you just said, if there's a better mask that's out there, I will tell you the people are walking out there with cloth masks, surgical masks, N95 masks, aren't providing the same protection that sounds like the mask that you're saying. So to expect people to have a false sense of security because they're wearing a mask and the person across from them, when the disease can still spread to them, I just think it's, if we just get off mandatory, strongly recommend, I think we'd be in much better shape.
Well, Commissioner Marriott, I'm going to go back to that article you stated you were talking about on NBC. That was actually News Channel 8 is what you're referring to. That was actually back from May. That was going around Facebook again yesterday. So that article is well over a month old. It's not new. That was in relation to the ones that happened at Advent, which we were all told about by Mike Napier on the phone a month and a half ago, probably. So that's not a new article. That is an old one. And so, I'm just going to say kind of what Commissioner Starkey, going back to her, is, why are these physicians, why are these hospitals stating this? And these are ones with their name signed to it. So I appreciate you said some physicians. Show me a letter. Show me a name. Show me a signed letter from one of those. These are all signed letters. We could. There's 100 more physicians, or 200 more, or 500 more that would do the same thing and say the same thing. So, you kind of got to bring something that shows proof that they're actually stating that. Three hospitals, actually more than 3 hospitals, because Baycare is a very, very large system. So multiple hospitals and multiple physicians. I talked to an ER doctor, and he went from his hours being cut down, which all ER doctors did for a long time because of the surgeries and stuff, to he can't believe how many COVID positive cases he's seeing in the ER now. It's really bad. So I know Mike talk about, you're doubling almost every day hospital admissions and ICU cases. And that's what we were all worried about. Remember the whole time we were talking about before, why we did not do a stay-at-home order, because those hospital admissions weren't there. The ICU filled beds weren't there. And now it's doubling every day. Listen, I just follow science. I follow physicians, and I think, if we leave it up to politicians or bureaucrats to be scientists and they're not, or be physicians and they're not, we're getting ourselves in a world of trouble.
Mr. Chairman, let me ask a question. Hillsborough had passed one, and they're getting sued now. Do you think that we're going to be looking at the same lawsuit coming up?
Well, I think I think our order is different, and how it's done and what they're focusing on is different than how this order is written. Mr. Biles or Mr. Steinsider, I think, can speak to that. It's not written in the same manner as theirs, and where I think that suit may be focusing on. I could be wrong, but Mr. Steinsider or Mr. Biles wants to respond.
Mr. Chairman.
Yes, please.
I'll be happy to respond. Ours is very similar to Hillsborough County's. One of the lawsuits that Hillsborough County has drawn, there are 2, attacks how it was adopted. In that respect, we are not at all like Hillsborough County, just because we don't have an EPG that is the way theirs is constituted is different. Our what we do. The Sabatini, Representative Sabatini lawsuit that he has filed against Hillsborough, Leon, and Orange, and the one that was filed against Hillsborough, that does not go into as much as how it was adopted. But it's also very similar to the lawsuits that were filed against Alachua earlier this year, and the cases, the orders which have come out of the Alachua litigation have upheld their mask ordinances. Granted, it's process, but the initial emergency injunctions that the lawyers took against, two different plaintiffs took against Alachua County, both in federal and state court, were found were the emergency injunctions were not put in place. So will you draw a challenge? Probably. Am I comfortable with defending it? Yes.
Okay. To give a little answer back to as far as where I got the information, as far as the doctor's orders, and I'll just read you what the quote came in. I'm not sure what hospital it's from. My cousin in North Carolina posted it last night. I can try to get a hold of him and find out. It has yesterday's date on it in their upper right corner. So I'll dig the information out as best I can for at least for tomorrow's meeting anyway. But I will say that I really, again, back to having our administrator make the decision as opposed to the Board of County Commissioners, I don't think this is the right way to do it. I think we should have had a COVID meeting, if nothing else, to talk about specifically this topic before he actually pulled the trigger.
Well, I mean, I can appreciate your statement. We do have a policy where we give the county administrator the powers under an emergency order to do those things. The reason being, and if I'm not correct, Mr. Steinschneider, is so you don't have to wait on certain things, whether it be this circumstance or a hurricane where something needs to be done very, very fast. He does have that. He or she, depending on who the administrator is at that time, has that obviously ability under our policies. If you want to change policies in the future, that'd be something we'd have to have a long discussion about, obviously.
You're correct. The ordinance that this is, you are acting in the ordinance does allow the board to delegate that authority to the administrator, which they did in this case. It's really no different than the administrator issuing a curfew order or a evacuation order during a hurricane.
And again, back to, I didn't say he didn't have the authority to do it. I just didn't like that he did it. I think it should have been done by this board. We had all these weekly COVID meetings 2-3 times a week. We ended those, and then to go all of a sudden have a change. This should have been done at a COVID meeting. We could have at least discussed it, gone through it, and dissected before pulling the trigger.
Okay. Commissioner Wells, please.
If I could, I'll be brief. And I told
your mic's off. There it goes. Yeah.
Can you hear me? Okay,
Yeah.
I'm trying to use the one over here because I think the other one's the issue. I totally support Mike and Napier and Andy and Dan and their team with this. Obviously we see contradicting things on everything, but I've got to go off our team and what they're telling us. And I respect the heck out of Mike, and he's been very conservative through this whole thing. So when he said that we need to do something, I get it. I do agree with Commissioner Mariano. We really shouldn't be making this mandatory because code can't even do their job as it is now. I can tell you, like this morning, I went to a restaurant and had breakfast at 7:30. And this is where we didn't do a great job rolling it out. We definitely could have done a better job. I know I've spoken to Dan about that, and I know Commissioner Starkey brought it up, is like the exemptions. If a business, including a restaurant, can operate under CDC guidelines, which they can, you really don't have to wear a mask to walk into the restaurant. to get to your table. You can still stay 6 feet. I just know I personally saw folks walk away today upset, didn't want to use the establishment. I don't like to see that. Did I have an issue wearing a mask to go to the table? No. But again, I think we've got businesses like the business I was at this morning and others, Publix, for instance. You shouldn't have to wear a mask in Publix. You can follow CDC guidelines in Publix. All the employees wear them. This is where it's kind of catchy to me because, again, I get it. We don't want to see more lives lost due to this, but again, I think if businesses can abide by the CDC guidelines, which are pretty specific, that's the only issue I have. And like the masks, I know we're giving 1 mask a day. How long is that mask really good for? You know, I know the ones I have in my office are made in China. I assume they're good for 1 use, and that's it. Mr. Biles or Andy, or you would need to come up to the mic, Andy. But I'm just curious, like if we're only going to give somebody 1 mask and it's only good for 1 day, that doesn't make sense. So I'm just asking the question. So.
No, sir. The masks, the cloth masks that are being issued to all county employees are good for 15 uses. They are washable. So you can use them, excuse me, for a period of 30 days with 15 washings.
And these are the same ones we're giving to the residents.
Yes, the Hanes, we're giving Hanes, that's a different brand, and that's the same way. They are actually the same usage.
I've had people ask me, again, those are questions, again, the CDC guidelines. To me, it's pretty simple. I know before businesses didn't necessarily have to wear masks, but most of them did, you know, so.
So with those masks, when we hand them out, when the businesses come and pick them up to distribute to their own employees and their customers and the public, if they're a point of distribution, they're given a form sheet that they actually take back with them. And it describes everything about the mask, the usage of the mask, and it gives great detail for it.
Mr. Chairman?
Yes, please go ahead.
Just something else I was reading from previous notes about looking at masks, and it says mayoclinics.com, N95 masks don't prevent the wearer from spreading the virus. Unfiltered air is released when the wearer exhales. That's for the N95 mask. Just a little clarification.
Yeah. So I guess I question why do physicians and surgeons wear them in during surgery if they feel something's gonna get spread. I would ask that to a surgeon and see how they would respond. Because does that mean they shouldn't? Does that statement mean that not what you said, sir, but what you read basically tell surgeons they don't need to wear masks during surgery now?
That may be a surgical mask is different than this N95. I don't know if the surgeons wear the N95s, but again, it protects the air coming in. It doesn't protect the air going out.
I remember one of the concerns with CDC in the beginning, and that was the health. I think Mike, you could jump into the health department was there was the fear that the healthcare providers would not have masks and have face coverings, and they were asking. And I think we all remember that because we had those conversations on those calls to save them for those healthcare professionals because it was so unknown if there was going to be a really quick outbreak or not, if they were going to need them. But I think that's why. I don't think that's why CDC, one of the reasons they stated they changed and said people should be wearing them now. Again,
Commissioner Moore?
I'm sorry, let me just finish that sentence if you don't mind. We've been very, very conservative in how we've done these things. And we continue to, the health department has, Mike has, our team has, Dan, Fossa, we've been very, very thoughtful in this. But again, I tend to lean towards physicians and what they're asking and what they're stating, especially when it's evidence-based. And they don't make statements unless it's evidence-based. They go to school for a long time. So I'm more apt to listen to somebody that's gone to school for 8, 12, 16 years, depending on what their specialty is, when it comes to these issues like this. Especially, again, you saw on some of the things they sent to us. I mean, the letter from both Advent and Baycare takes you to, well, at least the one from, I think both, but maybe it was just Advent, takes you to the Lancet, which analyzed 172 studies from 16 counties. 16 countries. Sorry, I said 16 counties. I apologize. 172 observational studies from 16 countries. And that's where they're getting their data from. So it's not on a whim.
But
Commissioner
think of
Starkey.
those studies aren't pure.
Pardon me? Go ahead. What'd you say, Commissioner?
If they're looking at studies that others have done, it's not a controlled scientific experiment, is what I'm telling you.
I think you need to read the studies. The ones that these physicians sent, in the 18 or so that one of the physicians sent, I would I do my due diligence. I would ask you to maybe read the same thing and then come to a conclusion after that.
I will do so.
Commissioner Moore?
Commissioner.
Yeah, I'm
Sorry.
on the Mayo Clinic website where it talks about how the CDC did an about face and they are recommending that you wear masks on the Mayo Clinic website. And they go into each kind of mask and why it's good and why it's not, but and they tell you how to wear it correctly. So the Mayo Clinic is suggesting that you wear the mask.
What does it say about the filtering of a cloth mask?
What it says is on an N95 mask, the kind that has that little filter that allows you to blow out, it's not good because if you're symptomatic and you don't realize it and you're out, you could be blowing out the virus. But on a cloth mask, it says cloth masks should be worn in public settings where social distancing measures are difficult to maintain, such as in grocery stores and especially in areas of significant community-based transmission. And then it goes into some pointers. Don't touch your mask. If you accidentally touch your mask, wash or sanitize your hands. Remove the mask by untying it or lifting off the ear loops. Wash your hands immediately after removing your mask and regularly wash your mask with soap and water in the washing machine. It's fine to launder it with other clothes.
Okay, thank you, Commissioner Starkey. Again,
Mayo Clinic.
I'm fearful of these businesses. I would hate. It would be just the worst thing in the world if they had to go back to stage one, or they actually institute another stay at home. That would be detrimental. It would just put so many people out of business. I don't think they can handle so many of them, especially the small ones around here. They can't handle it again. And if they're saying it might work, I don't. Any further discussion? If we're going to do anything, today's the day and not tomorrow. It was already brought up. We're not moving this on to tomorrow. So
I'll make a motion. We change the verbiage from mandatory to strongly recommend.
I wouldn't mind seconding it, but there's obviously three of you that are in favor of keeping it, so I'm not going to second it. But I do agree with Commissioner Mariano. I really think that again we should. It's just tough. It's tough on those business owners for us to go out and try to cite them. I know we're not doing that, Dan, but I think the verbiage could have been a little bit different.
So I did not hear a second. So the motion dies without a second. Or anything else that we'd like to bring up, Commissioner? Anything else about this item that we're discussing now?
I'd just like to thank the board members for talking about it intelligently, going through and getting the information out there. I appreciate it. Thank you.
Thank you, Commissioner Mariano.
There is one more thing on that. Yeah, there's one more thing I do not like in the emergency order. That is the number. There's a phone number on there to kind of turn in somebody. And I don't know, that made me, I got some comments on that. And I thought, well, I'm not sure if that was necessary that we turn everybody into enforcers as well. So I wouldn't mind taking that out.
Okay. Explain. Okay, Commissioner Starkey. So there's a number.
There's a phone number.
Posted. It was the code enforcement number, if I'm not correct, right?
I don't know.
I don't believe the order has a phone number in it.
Okay. So the order itself does not have a phone number. The order itself, Commissioner Starkey,
It may have been.
I'm reviewing it, but he does not see a number in the.
Yeah, Commissioner Moore, this is Dan. the FAQ that we put out has the customer service phone number on it. So that if people want to call with questions or have, questions about how it's being implemented or want to get a comment or complaint, if you will, to code, that's a route to do it. But it's not in the order, it's in the frequently asked questions that we put out.
Okay, well then I'm okay with that.
Okay. Did you have anything else to add, Commissioner Starkey?
No, that's okay if it's in the FAQ and not in the order. I just, I did receive some comments, maybe you guys did too, about turning other people in, which is a little harsh for me. But if it's only in the FAQs and it's for them to get more information, I think that's legitimate.
Thank you, ma'am. I think what County Administrator Biles stated earlier was, and I think it was Mr. Bailey too, what they've done so far is really focused on education, because, there's the circumstances, for example, and I'm just going to use an attorney's office as a great example. They have separate offices. They can maintain 6-foot distance. They're not required to wear them, for example. There's some retail establishments that don't have many customers, even though they do retail type businesses, but they're more of a production based business that has a retail desk or something. They're able to maintain it, and there's not maybe just a few customers coming in a day. From my understanding, they would just they put one on when they have that direct interaction with that customer if they're doing a point of sale or something. Is that correct, Mr. Biles?
That is correct. That's the reason we wrote it the way we did, so the business can look at their operation and make their calls to where they think they're going to have conflicts with respect to social distancing. And in those areas, either have their employees and our customers wear masks. But that's why we wrote it the way we did, so that the businesses could make that determination, because every one of them is a little different. And we wanted to give them the ability to do that.
Yep. I know on my side of the county, my side of the county, before there was any type of executive order, every eating establishment I ever walked into, every server or host or hostess was already wearing them.
Patrons weren't.
Yeah, not the patrons, obviously, but I know the staff, they were. I actually went in a few places, like Commissioner Starkey said, before this took place too, and they actually had notes you weren't allowed in, actually, unless you were wearing one. Quite a few, actually, on the east side of the county. I think Costco was one too, right? Wasn't Costco doing that too? I don't have a Costco membership, but I heard that. Anything else? If not, we're adjourned. Anything else? Seeing none, we're adjourned.
Mr. Chairman, prior to us starting, before we get to the action items, I just want to make sure that, as everyone knows, due to COVID-19, we are in a virtual meeting forum. This meeting is being held virtually. And I ask that all THC members please note a roll call vote is required for all action items in order to establish a quorum, since not all members are physically present in one room. And each member must verbally state their name and indicate a yes or no to an action item. The public can participate in the virtual meeting during the call for the public input section or the public comment section by either phone call during the meeting or via email. Thank you.
Thank you for that information. Okay, folks, let's go ahead and get started. This is the Monday, June 8th, 2020 Technical Advisory Committee meeting. I think we just went through our introductions. Do we have any public comments or anyone that's on from the public at this time?
Not that I'm aware of, sir.
Okay, thank you. Moving on to agenda item number 3, the approval of the meeting minutes. In your packets, if you've had those and if you've had a chance to take a look at, these are for the approval of the minutes dated May 11, 2020. Any comments or items of clarification?
Sorry, guys, I'm here.
Hearing none, I'll call for a motion approval of the minutes for May 14th.
This is
Or
Kurt
May 11th, I'm
Scheibel.
sorry.
This is Kurt Scheibel. I don't see my name on attendees. I thought I attended that meeting.
I apologize, Kurt, that could have been, that was probably me. I thought I had put your name in there. I will add that to the list.
You have me under PCPT, but you don't have me as members and alternates. That's what the issue is.
Okay, all right, but I thought it, okay, that's fine. Thank you.
No problem. Other than that, I move to approve the minutes. Kurt Scheibel.
Second, Christine Antis.
Okay, if everyone would just list your name and if you are in favor of the recommendation of approval for these minutes, please.
Todd, let me go through the list. Cynthia Seidel.
Thank you.
Cynthia Seidel, aye.
Debbie Bulldog.
Aye.
Chris DeCiantis.
Great pronunciation. Aye.
I'm sorry.
I think that was me you were talking about.
Yes. Chris DeCiantis.
Nope, try again.
Was that a yes, Chris?
It was yes for the minutes, but no for the pronunciation.
You tell us how you pronounce your last name.
Phonetically, just how it looks. Dianantis.
Dianantis.
Got it.
Mr. Kurt Scheibel.
Aye.
Mr. Todd Vanderberg.
Aye.
Mr. Venkat Vatukuti.
Aye.
That's all I believe what we have as far as board
All right.
members.
Sounds
It looks
the
like
minutes
Mr.
are approved.
Giannontis' name is spelled incorrectly on the meeting attendees.
Yeah, I pointed that out to them. I pointed that out. They refused to change it.
That's me. That's me. I apologize. I do have to take a crash course in minute taking. I appreciate your patience.
It's their excuse for mispronunciation.
They almost had me.
Well, thank you all. The minutes are approved as presented with the minor comments made. Next item number 4 on the agenda is the report on MPO board actions. Manny, we have anything on this to discuss?
Well, just very briefly, we have 3 action items, just like you guys had in May. They were all approved. The UPWP was approved. We had our joint MPO DOT certification that was approved. And we got our planning agreement for the 2-year UPWP also approved. There was 2 list of priority projects, and also the draft TIP was presented when we opened up the public comment period, which ended, and this month is also before you for the final approval, both the list of priority projects and also the TIP. That's all.
Okay, thank you, Manny. Well, moving on then to the action items. Manny, do you want to provide us just a brief overview of the 2020 LOPP.
Right, I would like for Todd, if you go to page 10, and there is a link on there, if you can pull it up for us. So I'm gonna try to kind of summarize what we've done to date without going through all of the pages. I would probably summarize that there were like 3 major changes to the priority list from 2019. The first change was that we removed 4 ATMS projects, since they are funded by the county, and those were priorities number 3, 4, 5, and 6 from 2019 that you see on this list.
So Manny, just a point of clarification. Bruce B. Downs, State Road, County Road 581 is being partially funded by DOT.
Okay.
Remainder of those ATMS projects.
Perspectives on how to approach issues, problems, and challenges.
Probably the best portions.
Perspectives on how to approach issues, problems, and challenges.
Probably the best portions of the program is really the relation.
Detail, be advised that on June 29th, 2010, Officer Jeffrey A. Kokab and David L. Curtis were conducting a traffic stop in the area of MLK Boulevard and 50th Street. During that traffic stop, they attempted to take a suspect into custody on an outstanding warrant. That suspect produced a concealed firearm and first shot Officer Kokab and then Officer Curtis. Both officers would succumb to their wounds. The suspect fled on foot and after a 4-day intensive search was taken into custody. He was tried and convicted of homicide against both officers. Officer David L. Curtis, you were not forgotten. Officer Jeffrey A. Kokab, you are not forgotten. All uniform personnel, present!